afternoon, and welcome to our second webinar episode on autonomous mobility hosted by the Jacksonville Transportation Authority.
Recording in progress.
My name is Nat Ford, and I have the honor of serving as the CEO of the Jacksonville Transportation Authority, and I had the pleasure of joining as a panelist in our first webinar episode, Autonomous Mobility Disruptors. And this afternoon, I have the honor of serving as your moderator for episode number 2, The Benefits of the Disruption. Before I move to introduce our speakers, let me say a few words about today's panel. Those that know me, you have heard me say that autonomous vehicles and autonomous vehicle technology is not a matter of if, but of when. A lot is being done as it relates to the US and advancing this technology, and it has the ability to positively impact many sectors from mobility access to workforce and economic growth to sustainability. In today's panel, we will cover topics such as how autonomous mobility technology is inspiring a new generation of students to seek a career path in public transportation, elevating education research in science, technology, engineering, and mathematics, how it can all increase the access for everyone in our community, no matter where you come from or whatever special needs you may have, and how mobility connects us all, especially how autonomous technology helps break down silos among industries, all for the betterment of our communities and our customers. Today's webinar is to be an exciting one, and I'm so proud to have these very special guests with us. So stay tuned till the end for a wrap-up of their ideas presented by our panelists and to hear more on episode 3 of our webinar series. I'm excited to announce our panelists today. Welcome and thank you all for joining the conversation. First up, we'll have start with Ron Brooks. He's a graduate of Indiana University and a 30-year veteran of the public transit industry, where he has focused on making bus, rail, paratransit, and other services accessible and equitable for everyone, including people with disabilities. Ron is the founder and CEO of Accessible Avenue, and he is the Senior Director for Policy and Stakeholder Engagement for UServe, a transportation network company adapted to meet the needs of people with disabilities. In his off time, Ron is a committed advocate within the blind, low vision, and disability communities, where he serves on a number of boards and committees for several nonprofit and community-based organizations. With that, Ron, welcome to our webinar, and I'll turn it over to you for a couple of opening remarks.
Well, thank you so much. I appreciate that introduction and those kind words. And I am super excited to be here. We're going to talk a lot about what makes autonomous vehicles special, what makes this technology a force for good in the world. And I'll just start. I had the opportunity to share some of this at an event back in Jacksonville in May. And from my standpoint, this technology is already transforming my life. I happen to be lucky enough to live in a place where this technology exists in a commercial market, in a rideshare capacity. I use it weekly at least, and it's transformative, and it has tremendous potential to benefit people who use public transit. It makes it that much easier to not need to own your own personal vehicle and all the expenses that go with it. I have teenagers, we have cars, I understand, and it's expensive. So I think the day will come when this technology completely democratizes mobility for all of us, including people like me who have lived experience with disabilities. We have some work to do to get there, and I'm super excited to be a part of this conversation and a part of that journey to bring this technology to the world and to public transit. Thank you again for having me.
Well, thank you, Ron, for joining us. Our next panelist is Dr. Gwendolyn Goodwin, who serves as the Director for the Center of Transportation Training and Research for Texas Southern University. Dr. Goodwin has a 34-plus year career in researching project management and policy planning, including investigating transportation and mobility impacts in low-income communities, evaluating mobility challenges that are facing seniors, the disabled population, and other underrepresented communities. Her work has been published in peer-reviewed journals conference proceedings, and technical reports. Dr. Goodwin, we're so excited for you to join us today. The floor is yours for your opening remarks.
Well, thank you so much for those kind remarks. I'm really here to be an advocate for community and communities that are in particular that are underserved. So my main focus with the importance of AVs would be just educating underserved communities as to what they are. And then second, how do we integrate autonomous vehicles into underserved communities? What does that look like? How do they experience it? And then finally, how do we allow underserved communities to participate in this new workforce that will be created as a result of AVs? So jobs, new careers, how do we tap into that? So those are my main three emphasis. And thank you again for inviting me.
Oh, thank you, Dr. Goodwin, for joining us. It's so important, the subject we're covering today. And finally, our third panelist is Neal Morgan, who serves as the Director for Facility Services at the Mayo Clinic here in Jacksonville, Florida. In his role, Mr. Morgan oversees environmental and general services as well as fleet management. And in his previous roles with the Mayo Clinic, he had responsibilities over planning, operations, and security, and served as the Assistant Director of Security. Mr. Morgan is a police officer by training and a veteran of the U.S. Armed Forces and holds multiple degrees from St. Louis University Park College, including a Master of Public Administration degree in Disaster and Emergency Management. Mr. Morgan, first of all, thank you for your service, and we're so glad that you could join us today. I'd like to turn it over to you for some opening remarks.
Thank you, Mr. Ford. I appreciate the opportunity to join the group here in this discussion. So the whole world of autonomy, I think, is huge, right? So especially now it's in the healthcare industry, we're starting to not only with specific AVs, but just other opportunities to identify autonomous solutions in various venues, right? So this is an exciting time, at least in the healthcare arena, from the experience and discussions that I've had, it's exploding. And so to have a discussion about autonomous vehicles and just autonomy in general, I think is fantastic. So I appreciate the invite. Thank you.
All right. Well, thank you, Neal, for those words, as well as thank you, Ron and Gwen. And I think everyone can clearly see that this is going to be a very insightful and interesting panel. So with that, let's open the conversation. I'll start out with a couple of direct questions, but if any one of you have any thoughts to add to the discussion, we welcome that. To get us started, Ron, I'm going to start with you. You've dedicated your life to improving accessibility for everyone. What have you found as the most successful stories to share on why automation is so critical to our communities, our economies, as well as our cities? And how does this technology support the riders, and specifically riders with special needs?
It's a great question. There's lots of parts. And I think the thing that I would start with, and I think this is true for everything we do in life, a story makes it real. And when I think about this technology, and when I talk to people about autonomous vehicles and certainly their role in my own kind of life and my own experience, it's all about the story. When people understand how this technology impacts a person's ability to simply leave their home with dignity, with independence, and dare I say with autonomy, and not just the vehicle, but the autonomy of being able to make your own decision about where to go. One of the things that I read recently was coming from somebody in the disability community, and I don't remember where I read this, but one of the things that people talked about was the fact that for the first time, folks are able to use a vehicle without having adult supervision from another human being. And if you think about that, you think about a 16-year-old who gets their first driver's license. It's not the driving that's the cool part. I mean, that is cool, but it's the ability to go where you want on your own terms without somebody telling you what to do and where to go and sitting next to you to make sure you did it. And with 16-year-olds, it's probably a good idea if we kept that. But it's that feeling of independence that this technology creates. And that'll be true in paratransit when this technology, and there's already been some demonstration work around how this technology might benefit people with disabilities who use paratransit. There's, of course, there's some work that's now happening on the shuttle side. And everybody that uses this technology, for the most part, is saying the same things. Even the people who were a little nervous at first, they're coming away from the experience with, this is amazing. It's amazing to be in a vehicle that is driving itself. It's amazing that I can go on my own and I don't have to wait for somebody to help me do it. It's amazing to be able to be out and about. And I think that that is really those are the stories that are powerful. It's the simple things. It's going to the store. It's going out to eat. For me, it's my wife, who's also a non-driver, going out on our own for the first time in our lives in 27 years of marriage, on our own without somebody else in the car. So yeah, those kinds of stories are powerful. And I kind of lost the rest of your question, but I think ultimately, that's where it starts. It starts with the stories and how this technology benefits people's lives. And I think that will be the reason that people can get behind it and support it. But it all comes from direct experience, which is why we need to keep talking about it and getting this technology into more and more places so people can use it.
Hey, Ron, just to follow up on that, your story regarding that night out with you and your wife and that independence is something that really resonated here in Jacksonville when you shared that story. Do you mind taking a couple of minutes more and kind of giving us a little deeper dive on that feeling? Because I think that is so critical in terms of what we're talking about. It's technology, but it's really, at the end of the day, it's about the people and what we're doing to help people fulfill their lives and their dreams.
Yeah, I mean, it's a really simple story. And if you think about it, we all, any of us who have been, married or been on dates or been out with, people, one of the things, it's really nice, to be able to go out with your partner. And the story that I shared was, I met my wife in San Francisco, back in the early 90s. And every date that we took was either on public transit, which was great because as a non-driver, that's pretty helpful, or it was in a taxi. And then later it was in Uber or Lyft and now, Userve in some cities. But, it was always in the back seat of a vehicle driven by somebody else. And we never, as a couple, had the opportunity to be by ourselves and just go out and do our own thing on our own terms without somebody having to know our plans and be a part of them. And it was January 2nd of this year, one of the rideshare providers who's using autonomous vehicles, it was Waymo, began operating commercial service here in Phoenix. And we happen to live in an area where the service is available. So we took that first trip and we went to a little Thai restaurant that we've been to many times, but we went by ourselves, totally by ourselves in a vehicle with nobody else. And it was mind-blowing for the first time in 27 years of marriage and 29 years, including the time we dated, to have ever been in a vehicle by ourselves on our own terms, just going out for dinner. And I mean, it gives me chills to think about it now because I'm in my mid-50s, and it was the first time I'd ever been out with my girlfriend and now wife of 27 years and mom of my 3 kids. It's just very, very powerful, and everybody deserves that autonomy. That's part of the American dream, I think. I think everybody deserves that.
Ron, thank you for sharing that story. And I think that's why this session of our webinar series is so important. It's not so much about the technology, it's about what does it mean in terms of quality of life and independence. And it's hard to measure that. But again, it gave me chills also hearing you tell that story once again.
Yeah.
Thank you. Neal, during the pandemic, JTA partnered with the Mayo Clinic to run AV shuttles from your COVID testing site, drive-through testing site on Mayo campus, to the labs where those testing samples were being processed. And what was to be a 1-month pilot extended to 4 months Due to its success, it got us the JTA and Mayo Clinic international recognition and awards. The pilot also showed how automation and transportation can be so supportive of our community in critical times. What do you see as some of the opportunities AV may create for workforce development, and what is needed for this opportunity to reach scale so that we can advance it to its full potential?
So it's a great topic. And I'd like to do a little prelude to that on our partnership with JTA has been going on for several years. In this particular instance, the AV vehicle discussion, the conversations between Mayo and JTA were taking place, and we actually got very close to getting autonomous vehicles to answer the part of your question, which was getting our workforce from where they are parking their vehicles to where they actually do the work. So if you talk to some Mayo Clinic employees, they'll tell you that parking is not proximal to where they actually do their work. We provide some shuttle services, current require humans to drive them. And we were working with your team, Mr. Ford, to look at some autonomous solutions. And then the pandemic struck. So the workforce was decreased as a result of the onset of the pandemic. We didn't know what we didn't know. And then you all reached out to us and said, hey, we might have a solution. What do you guys think about the autonomous vehicles to help with the workforce shortage? And I took that question up to the leadership, and they're like, yes, let's see what we can do, because we don't have the people to do it. We don't know what the impact's going to be yet to the people. So this was a great solution and opportunity, and it worked out fantastic. The people here at Mayo Clinic we were very excited about this, the initial discussion. And then when we actually got to implement it, it was a success. And so to your point, Mr. Ford, the vehicles, they were stationed out where the patients would come in to get swabbed. Those samples were stored in coolers until there was enough samples to then be transported to our lab, which was a distance away, probably about almost a quarter of a mile. In the AVs, they got loaded up with the coolers, drove straight over to the lab. Lab staff would come down, the doors would open up automatically. They'd go in, get the cooler, take them up to the lab, and the vehicle would go back and get another load. And so this went on, to your point, for a long time, longer than we had anticipated, but it was a phenomenal partnership, and we truly appreciate that.
Well, I'll tell you, Neal, thank you for that partnership. And you're right, we were working on moving people, but this technology allows us to help people by taking some of the workforce that would have been dedicated to focusing on transportation, moving those samples. Those healthcare professionals were now able to be deployed to the core responsibility, which was helping to survive this pandemic in our community. And thank you for that partnership. And there's been some recent conversations to talk about the development that's occurring on the Mayo campus and how to assist with moving, obviously, the healthcare workers and patients efficiently from the parking locations to the medical facilities. And moreover, another step is I hear there's a lot of work that needs to be done as it relates to just even moving some of the bed sheets and things of that nature for the hospital over to the new processing facility that you folks are getting ready to build. So as you're expanding, we're looking at opportunities as the JTA with autonomous vehicle technology to assist in your development and your success. So thank you for the partnership.
Thank you.
All right. So I want to just, Gwen, let's turn to you now. You've dedicated your life to lifting others through the work you do, actively serving as a mentor, including service on thesis and dissertation committees. Tech hubs have become effective nationally to spur innovation, and middle schools to graduate degree programs are incorporating curriculums that are now including automation. How do you see this technology benefiting the next generation of innovators and dreamers? And what can we do to ensure that those dreams become a reality?
Well, that's a very good question. So I'll start off by talking with you about what we're doing here at Texas Southern. So through our partnership with Houston Metro, we were able to provide the very first AV, and we're very proud about it, at an HBCU. And in fact, we were the first university to have an autonomous vehicle on campus. And why is that important? Well, that's important because this was in our pilot program ran from June of 2019 until the pandemic started. And it was important because it was our chance to test the new technology. That was great, and see how it ran and operated and what were the efficiencies and all of that. But it was a first introduction to many of these students to this technology. And we wanted to do it in a place where they could come up and ask us lots of questions, figure out, are there classes going on that teach us about AVs and how they could be a part of that. So it was very well received on campus. And like most students, we had a lot of people curiously walking alongside of the AV, trying to make it stop and do things, or with their earpods in. So it was very beneficial for us to figure out how people would respond to it. The second thing that we're doing is that we began introducing this in our National Transportation Summer Institute. So that program is funded through the Federal Highway Administration and the Texas Department of Transportation. And so we've been holding this program, and it's primarily for students that are in grades 9 through 12. And so the goal is to introduce them to transportation careers. So this was a wonderful opportunity that summer to introduce into that curriculum, that 2-week curriculum, a package on autonomous vehicles. And so that's our goal, is to keep updating and giving our students the best possible information that we can give them on new and emerging technologies. The other thing that we do in graduate school is that we are interjecting small, short modules. So it takes a very long time to do a course development, and many approvals are needed, but we're working at least to take pieces of the technology and teach our up and coming graduate students about the importance of AVs, how they're going to be used in the future, how they're going to impact communities that they're working with, and how to get other underserved communities involved in this and why it's important. So that's really one of our key focuses. And then again, I talked about workforce development, and I will kind of tag into the what Neal was saying and add to it, is that some of the things we figured out when we conducted our phase 1 was that there's a big need to find people that can work on the vehicle, so mechanics. So we need everything from engineers to mechanics to software programmers. So there's a wide range of things that we can do. And of course, we're looking towards what are the options throughout that workforce. So from certifications all the way to 4-year degrees. So how do we move our academia forward so that we can ensure that we're ready for this technology?
Well, thank you so much, Doctor. And I appreciate your perspective and insights. And similarly, here in Jacksonville, our program, we recognize that critical workforce development component in terms of the jobs of the future. And we have a partnership with Florida State College here in Jacksonville, and we were able to get a certification to now actually teach a curriculum on autonomous vehicle maintenance and tech skills. But what really gets me excited is when we took our autonomous vehicle fleet to some of the elementary schools and middle schools and high schools, And we put these road shows on, and literally thousands of our Duval County Public School students have been able to touch these vehicles and
Yeah.
ask questions, and just to see their eyes light up to
Yeah.
see this new technology. And for the younger ones, they may never be in a position to drive an automobile conventionally like we grew up to do, and just to see their excitement around STEM and these new technologies. And so that really has gotten us excited about these programs. Again, far beyond the technology, but what does it mean from a quality of life, job creation, safety, security, efficiency standpoint? And going back to Ron's story, just the basic freedoms that many of us enjoy, that people in our disabled community will now be able to participate and enjoy at the same level. So I thank you all for those responses to those direct questions. Now I have a question for all of you. So please take the opportunity to weigh in. And from your perspective, both professionally and personally, what would you like to see more of to advance the policies related to automated vehicles in the United States? What could be done to really accelerate the deployment of these vehicles from your involvement and engagement at your levels?
Well, this is Ron. I'll go ahead and start. Yeah, I don't know if it makes it faster. Every time you say the word policy, I picture regulations, but I think it's needed, and that's to really start to think through, and I'll just speak from my own experience, and certainly for public transit, is the accessibility elements. There are many manufacturers of the technologies and also service providers. So both the OEMs who are building these vehicles and also the folks who are, who are bringing these services into the industry. Everybody is interested in working on creating an accessible model for these vehicles. What does that look like? And it's not as simple as having a ramp and having a wheelchair accessible, spot for a wheelchair to go. There's a lot more to it than that. There's the apps that we need to think through. There's the vehicle configuration. Certainly there is the securement areas for mobility devices. There's the whole user experience. So, we need to have those things. We need to get some clarity around what do these vehicles need to offer, and how do they need to offer it. And I think having some policy direction will help the industry focus its efforts. The one thing that I really like is that the industry hasn't waited for regulation to do this. All of the major providers have public-facing councils and committees made up of folks in the community who are giving them feedback. The US DOT back in 2021 ran an innovation grant process to try to get some solutions developed to some of these challenges. But now what we need to do is really learn from all of that and sit down and codify as an industry. What does it look like? What do we need it to do? Because I'll tell you, this stuff is transformative, but only if it's accessible. And I believe the day is coming when we will see paratransit services bring people with autonomous vehicles to our accessible fixed route transit systems. But for that to really happen, we've got to get the accessibility and the user experience spelled out so that everybody knows what we're trying to hit. So, I think that's something that I would personally like to see happen.
Hey, Dr. Goodwin, any thoughts on what we need to do to successfully advance policies related to these vehicles? I know many of our brethren across the country are using pilot strategies, but we have to get to now full deployments to really reap the benefits of what we've discovered through these pilots.
I think that this is a great question, and I think that to reach full deployment, it's going to take a lot of money. And so how do we create enough interest around this and lobby our elected officials to increase funding in this area. And from the aspect that I really do the most work in is in public transportation, which is not all, which is a very expensive process. But how do we impress upon them the need for the transit dependent person to have access to this technology and the things that it can do? And like what Ron was saying, just the user experience. So there are different things. How will these communities interact with it? When we talk about energy, going to EVs and EV technology, it's the same thing. How do we resolve issues in the community as we talk about charging and where things are located? And a lot of people have problems keeping their utilities on. So same thing. So will the technology of the phone, what is going to be the user experience? So I'm with Ron on that. The good thing about Texas is that we're pretty open to these pilot projects. So we have a very welcoming vibe, and we really want more people to come and test and use these pilots to prove how worthy they are for future.
Right. And Dr. Goodwin, it's great that Texas has that. We have a similar environment here in Florida with the opening of Sun Tracks in Central Florida, where there's actually, through Florida Department of Transportation, a model city that is designed to be a smart city. And the, I guess, the full-scale testing of autonomous vehicles are happening in Central Florida. And then there's 8 different projects that are underway in the state of Florida in terms of deploying autonomous vehicles. So, that policy journey is beginning here in Florida as well as in Texas. And we watch with close interest what you're doing there. And it's just really exciting and invigorating time to be in this industry. I'm going to turn to Neal for a second in terms of this question. And Neal, the work we did with you on Mayo Clinic, at Mayo Clinic, it created a unique opportunity for the JTA because, it's a closed environment. It's a medical campus. And, the work we were talking about doing pre-COVID, which was moving your employees from parking facilities to their work locations. And then, as I mentioned, discussion of taking, hospital laundry to your processing plant was also a pilot or a project we were looking at. What are your thoughts both on campus or closed campuses, but also outside the campus as it relates to, what do we need to do to advance policies related to autonomy?
So we had in the example that we've shared, we had the luxury of being a little bit unique in the state of Florida, because I don't think the state of Florida has gone to, correct me if I'm wrong here, Mr. Ford, level 4, where it's full autonomy, where we actually got to experience that on our campus, because our large campus is private property. And so we actually got to see the results, if you will, of full autonomy. Now, we had some safety people that were following the vehicles, but from the aspect of the vehicle itself, it was fully autonomous. Right. And so I think, to the point of everybody that's mentioned this, from regulatory or compliance perspective policy, we're going to need those use cases, right? Because that's going to provide the actual data to get us to the point where we can start to now do more implementations. And so we're very close, to my knowledge, to getting there for both. When we're talking about autonomous mobility, it's in vehicles, we're talking both ground and air, right? So they're both very close to getting to that point of full autonomy or close to full autonomy in the state of Florida, which is going to be very beneficial. So the policies and the pilots, I think the pilots are going to help move the policy along. But I think once they're fully implemented, the people are going to start to see the benefits of both these mobility functions, and it's just going to be a success.
All right. Well, we early our registration process identified about 100 or so people who registered for this webinar, and I want to thank everyone for joining us. before I go to the chat, I've got one last question for our panel, and then let's see if we have time to take a couple of questions through the chat. What can the registrants, the viewers of this webinar, what could they do? What would be helpful to you in terms of the progression of wide-scale deployment of AVs in our country? And so what do you think the folks in the audience can do to help out? And Neal, I'll start with you.
So I think as long as they just keep an open mind and understand that this world of autonomy, if you will, it's coming, and not to be fearful that it's intended to replace people necessarily, but to supplement, right? So as we start to have these conversations within Mayo Clinic about identifying areas that we can utilize autonomous vehicles, units, we're making sure that the change management or the change is very key, right? So the message being conveyed to the staff is that we're doing this to supplement the staff so that we can redeploy where we need human interaction. It's where it's more important, right? So we've identified an area that there's a device, some type of a machine that can do this repetitive work. However, the technology hasn't advanced to a point yet, and I don't see this coming anytime soon, but I know there's great efforts to get there. But there's still going to be pieces and things that are just going to require human interaction intervention. And those are the things that we just need to focus on. So for the viewers, if they can just keep a positive attitude, understand that this is not to replace, it's to enhance and supplement the human intervention interaction.
No, Neal, great insight there. Ron, what say you as it relates to what do we need from this audience in terms of deployment of AVs in the U.S.? How could they help?
So I think that a couple of words come to mind. One, of course, is engagement. And I'll talk about that for a second, but then I want to talk about something else. And you know, with engagement, I think it's really just being a part of the conversation and recognizing that autonomous vehicles are already a thing. They're already driving around on streets in many places and doing many different things. So yeah, I read a lot of public facing content from people who are both inside and outside the industry. And everybody kind of universally says it's cool, but some people are still not too sure and they're afraid, and some people are even still kind of deniers and saying it's not going to happen. It's happening. So I think engaging around the question of what do we want it to look like, as opposed to engaging around, is it, you know, is it going to happen at all? I don't think I want this. Yeah, that's not constructive at this point. What's constructive is to say, we need this to work a certain way. We need it to do certain things. We want it to look a certain way. We want it to be here. You know, we want it to solve for these challenges. That's the kind of engagement that is helpful at this point. And it's engaging with the communities where you live. If you have a deployment in the area where you are, it's checking it out. It's asking questions. It's raising your concerns. It's giving it a try. The second thing I think we need is we need to take a step back and have vision about how cool this really will be someday. And I'm a student of history, and I grew up in a part of the country where the labor movement was a pretty big thing. And you know, there was a time when people went to work in factories doing very unsafe things, and they did it for 70 hours a week or 60 hours a week. And they did it because to make a living that wasn't very good, because it's all they had. Automation and technology made it possible to reduce the work week to 40 hours, and for most people. And I believe that if we're smart and if we're really visionary, and if we see this technology for what it can do, and we really, really work at it, we can start to talk about work weeks that are shorter. We can start to talk about more free time. We can start to talk about jobs where we interact with people. And, it's a cool thing to think about the fact that if you are driving a bus today, your attention is spent looking forward into the street, driving that vehicle and being safe. If you have an autonomous bus that handles that for you, your focus can be facing backwards to look at your customers and the people that you're serving and the community that you're a part of. And I think that's a much better way to spend your time. And I think that just takes the vision for us to realize that the technology's here, it's safe, it's being refined, it'll get better. We need to focus on what we want it to do for us and how to get there.
Ron, it's very insightful comments, and sometimes we do have to look back to move forward. And it just so happens last week I was in London for a business meeting, and I got a chance to run over to the Transport for London Museum and to see kind of the history, particularly in public transportation, the history of transportation with innovation and moving away from manpower to horses that moved, carriages, to the combustion engine, going from the horseless, the horse-driven carriage to the horseless carriage. And they have depictions and information related to the perspectives at that time, and is just so timely in terms of what we're doing today. Some of those arguments and some of those naysayers and perspectives at that time, because of the fear of the new technology and change, but it didn't slow, it may have slowed it down, but eventually that technology won over, and we are here where we are today with transportation. And so, we can learn from the past that as you advance technology, there are, the change management process that we have to manage as part of this community. And so I would ask that the viewers really be part of that change process and be open-minded, and also be give us input as to how to successfully deploy these technologies that are coming, and making sure that they're fully inclusive. As it relates to this question with the audience, Dr. Goodwin, what are your thoughts? What do you think our audience could do to assist us in terms of wide-scale deployment of AVs in this nation?
Wow, well, you all have so eloquently stated most of my thoughts. My last thing is just continue to be an advocate, as you all have stated, and figure out how you can be. I think when we talk about public transit and public transportation, we shy away from it because we know about the issues of cost and concern, but we very much have to be a part of it. I'm glad Houston Metro is doing that. But with that intel, I think we should then also turn our attention to the public and do that educational piece where we talk to them about the safety, as Neal or Ron mentioned, and tell them you need to experience this first, not last.
Right.
So getting them to ask for it first in their communities.
I think it's so interesting where we are in terms of this journey, and it's an exciting time for anyone who's working in this transportation mobility space. And I always say that the better we move, the greater our communities will become, and it's all about mobility. And Dr. Goodwin, what's resonating with me is how we make sure those communities that, unfortunately, because of transportation, have less than positive healthcare outcomes, less than positive economic opportunity in terms of job availability, and those same communities that, frankly, from an education standpoint, are locked in because they don't have the level of mobility that public transportation with limited resources can provide to those communities, and what this technology may bring in terms of equity and accessibility. So thank you so much for the work that you're doing to bring along those young students and folks that are in these communities so they understand the importance of this monumental shift and transformation in terms of transportation. Got a couple of more minutes left. I have some questions from the chat, and I'll open it up for any of the panelists to respond to. Let's start first with this question. What are your thoughts on how AVs can help senior citizens become more independent? And I know Neal over there at Mayo Clinic, great number of senior citizens are visiting that facility, that world-class facility. I'm actually a patient of Mayo Clinic also, and so I see them firsthand, and you guys are doing a fantastic job. What do you see in terms of impacting those senior citizens that in our community need mobility?
So as I mentioned, we're looking at various opportunities for autonomous solutions. One of them that we're looking at for future is wheelchairs, right? So not only do we have a senior population, but we also have patients that are potential fall risks and have troubles ambulating, just mobility issues. So there's companies out there that we've been researching for autonomous wheelchairs. In addition to the autonomous shuttles, those are discussions that we're looking at as well. And so getting them from their parking lots where they park their vehicles to the actual brick and mortar is in an autonomous vehicle or some solutions that we're looking at.
Just to add a quick thing from here out where I live in the Phoenix area. First off, we did a paratransit pilot of Waymo, which is a rideshare approach back in 2019, kind of got shortened by the pandemic a little bit. But what we found is that, and that was in a community that, and when you talk about paratransit, you're talking about a lot of seniors just by definition. And I left the agency by the time the pilot finished, so I don't have all the data. I do know that anecdotally that folks who used the technology liked the technology, and that included seniors. They liked the autonomy, they liked the ability to make decisions and travel with much more spontaneity. We're doing, I believe it's May Mobility, and I'm not sure who all the partners are, but they are actually targeting a shuttle type service in a community called Sun City, which is a retirement area west of Phoenix. And I think we're going to start to get a lot more data. But in the early meetings for that project, there's already a lot of interest from the senior community. And yeah, there are some naysayers, but the seniors themselves are pretty supportive of this technology and pretty interested to give it a try. So I think you're going to find that seniors, like everybody else, is going to adopt this technology, maybe more slowly, but maybe not. They may surprise us all.
Okay. Dr. Goodwin, I've got a question I'm going to direct towards you from the chat. And I know you touched upon it, but I'm going to give you an opportunity to have a little bit more time. In terms of workforce opportunities and the work that you're working with your students, the question that's coming in is, my kids are into STEM and I'm still young. Is there an opportunity for me from a career standpoint? How could I get myself introduced into this new world of autonomous vehicles and autonomous technology?
Oh, that's an excellent question. And I will use the work that y'all are doing in Jacksonville. Seek out opportunities to begin with the certification. So it really depends on what you want to do. If you're already an engineer or if you're a computer scientist, then there's a way for you, see if you can incorporate an additional class. So it may not necessarily mean that you have to go and obtain an entirely different degree, but you may be able to supplement your education with a couple of courses and a certification. So that is an important piece of it. Or maybe within that, maybe your focus will be on safety. So how do you need to find those opportunities so that you can specialize in one area or another. I think in STEM, if universities have more opportunities to take parts in these pilot programs, I think that encourages more students to think differently. And I don't know if you ever had this experience, but we get a lot of students in that don't know what they want to do, and college is expensive, even at a state school. So by introducing them to a variety of things early on, your young kids, and letting them see it's an opportunity for them to figure out, what do they want to do, what really interests them, and to touch and feel through these summer programs that I know in Texas that we offer that allow them to ride and experience the autonomous vehicle and the like. I also wanted to just go back to the previous question and say about seniors and persons with disabilities. In our Houston Metro Phase 2 project, we hope to include more seniors, of course, because we were on a college campus. We we encountered very young people and then older faculty members. So we didn't inquire a lot of persons with disabilities. And so we're hoping to capture that in our Phase 2 as we go out and service the TSU and University of Houston areas, as well as a lower income area that surrounds, that is in our 3rd Ward area. We hope to get more passengers so we can find out what their needs are, how we can cater to them, and making sure that our vehicles are fully accessible for everyone.
Dr. Goodwin, to follow up on that, that 3rd Ward, that is your project right now, your pilot project. You are actually providing service to that community. Any anecdotal or, kind of responses you're seeing from some of those community members related to this new technology?
So we are about to start our Phase 2
Okay.
pilot in the next couple of months. Like everything else, the pandemic slowed us down. And now we're just trying to recover and make sure we have everything lined up, that we have the correct vehicle, that we have everything that we need. So we will be kicking off informally in November, and then starting the actual service in January or February. So doing some programming over the Christmas break.
It's just amazing the opportunities that we have here with our communities, both in healthcare, economic development, education, creating greater mobility for senior citizens and members of the disabled community. And this has just been so insightful. And part of the JTA's rationale behind supporting and hosting these webinar series is so that we can cover the entire spectrum. As we develop our project, we recognize that many of our peers around the country are going through the same journey that we're going through in terms of the JTA. And so our purpose of hosting these webinars is to talk about these shared experiences and lessons learned so that we're successful in deploying these new technologies in our community. I want to personally thank each one of you panelists for participating and looking forward to our next webinar. This hour has gone really, really fast, and I think we could have kept going here with a host of questions and answers, and I see more questions coming in the chat. We'll do our best to make sure we get them out to the panelists and try and get you some responses as virtual members. And so, to my panelists, I want to thank you for being here with us today and for your words of advice and encouragement. To our audience, I hope this session was well worth your time. For me, it certainly was. And I think you heard already a small request, but I'm going to make that request of you again. If you do believe that what we're doing as it relates to autonomous vehicle technology is a step forward to advance mobility, sustainability, equity, and more, get engaged, stay engaged, get educated. If you have some questions, all of us are willing to answer them. And we want you to help us bring others along. Make your voice heard in your communities. I follow pretty much what's happening around the country around autonomous vehicles, and there's correspondence, editorials, and stories around the country and in your communities. And we need you to lean in with your opinions and your perspectives related to deploying autonomous vehicle technology. And we need you to be an educator as well. To the future generations that want to see their dreams become a reality. I'm so excited every year when we have our summer interns, and the number of interns that are from around the globe that are coming to Jacksonville and they want to be part of this U2C project we have here. So with that, I invite you to stay vigilant. More information will be coming soon as it relates to our next webinar series. We're already populating that panel, and it's going to be all about the policy and regulatory issues and how we can elevate this conversation around autonomous vehicles and deployment in our communities. So with that, thank you to all who have participated. Thank you to my panelists once again, and have a wonderful rest of your day. Thank you.